Is the differential diagnosis process constantly evolving? Is the differential diagnosis process constantly evolving? This is a question that many people have, especially when it comes to autism spectrum disorder, often referred to as ASD. The answer is yes, and it is an important topic to understand. The way we diagnose ASD has changed significantly over the years. In the past, autism was defined by strict criteria that focused mainly on severe challenges in social interaction, communication, and repetitive behaviors. As research progressed, so did our understanding of autism. Diagnostic manuals, such as the Diagnostic and Statistical Manual of Mental Disorders, have updated their criteria multiple times. For instance, the third edition of the manual introduced autism as a separate diagnosis from childhood schizophrenia. This was a significant step forward. Later, the fourth edition expanded the definition to include a spectrum of related conditions, such as Asperger's disorder and pervasive developmental disorder, not otherwise specified. This change recognized that autism can present in many different ways. Most recently, the fifth edition of the manual combined these separate diagnoses into one category called Autism Spectrum Disorder. This change reflects a more modern understanding of autism as a continuous spectrum of severity and functioning. The criteria now focus on two main areas: ongoing difficulties in social communication and interaction, and restricted or repetitive patterns of behavior. This flexibility allows for a better understanding of the varying levels of impairment individuals may experience. The evolution of the differential diagnosis process is not just about changing definitions. It also improves how multidisciplinary assessment teams work. These teams typically include psychologists, speech therapists, pediatricians, and other professionals. They use their combined knowledge to provide a more individualized approach to diagnosis. The process involves ruling out other conditions that may have similar symptoms and identifying any co-occurring disorders. This requires staying up to date with the latest research and diagnostic tools. As our understanding of autism continues to grow, so does the ability to identify it accurately and consistently. The practical implications of this ongoing evolution are significant. It leads to better tailored interventions and earlier identification of subtle signs. For example, recognizing that some individuals may struggle with social communication without showing repetitive behaviors has led to the identification of social communication disorder as a separate diagnosis. In essence, the differential diagnosis process for autism spectrum disorder is not static. It adapts as our scientific knowledge expands. This ensures that diagnostic practices reflected the complexity and diversity of autism, ultimately supporting more effective assessment and care for individuals on the spectrum.